Hey, so I want to talk to all of you women who are suffering from endometriosis and all the various problems that you guys are having navigating through all the pain issues and the discomfort and the functional issues that you guys might be having in your bladder, in your bowels, in all the other areas of how endometriosis is just changing and affecting your life. Now, my name is Hina. I am a pelvic floor physical therapist here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania, as well as on the main line in Narberth, Pennsylvania. And, I've been treating women with endometriosis for 21 years. And what we've seen is that there is information out there for many of you on how a particular type of therapy can help, but there's also a lot of other issues that accompany endometriosis, and trying to navigate around all of these issues can be very confusing. It can be depressing. It can cause anxiety and cause you to feel like that there's no hope, you feel hopeless, and that there's no one who's going to be able to help you take care of this pain and manage it. And I'm here to tell you that there is really good, adequate help out there, and that we can actually help you navigate through these issues that you might be having. Now, why trust me? Because I've been doing this for so long, and we've treated so many women successfully in this area of endometriosis. Now, many of you probably already know this, but you know what endometriosis is. It's all of this uterine tissue that now is growing outside of where it should be. It should be in the uterus, but now it's growing everywhere else, and it's just creating havoc around all of your organs, your bladder, uterus, and your intestines, as well as the whole GI system. And it's almost like just creating all this inflammation, pain. Of course, it's accompanied by abdominal bloating and abdominal pain and just a whole bunch of other changes. Many of you probably already know this, but there are muscles that endometriosis will actually affect. And they affect muscles of the pelvic floor. Okay, these are muscles that are located inside the pelvis that you cannot see from the outside. But there is a whole system and group of muscles down here that actually, they basically give function to the urethra where you pee out of, to the vagina where you have sexual baby deliveries and all that kind of stuff and sexual function, as well as the rectum where you end up having bowel movements and pooping. And all of those things can be affected from endometriosis because these muscles have become tight. And when these muscles become tight, they can cause additional pain on top of the endometriosis issues that you might have. And for many, you guys might think, oh, it's the endometriosis, it's the scar tissue, I need to have surgery, I need to have this. But believe me, we have seen so many women where if they get this treated, along with a really good holistic approach, which is what we do, and I'm going to tell you what that means. With a really good approach and management, they actually go on to have really good results without necessarily having to need surgery. Now, I'm not saying some of you don't. Some of you do, and it does give significant improvements. But it is not uncommon for people to have endometriosis surgery and then the endometriosis comes back, or the surgery itself causes problems afterwards. And so what we do for any of our women, whether they're coming in before surgery and they're trying to avoid it, whether they've already had surgery and now their symptoms are starting to come back, for many of them, this is all of what we treat. Because these muscles, when they become painful, not only do they affect the pain that you're having, but there are other muscles that these muscles can affect that actually attach to the hips, that attach to the back. And I know most of you that have endometriosis have back issues, okay? They can cause abdominal issues too, in the abdominal muscles. So when I talk about a holistic approach, it's not just treating these muscles, okay? It's treating the whole system. It's treating this entire pelvis, treating the back, treating the hips, okay? Through many, many, many different techniques that start to loosen all of this up, decrease the pain, and start to improve your functioning so that you could get back to having sex, so you could go back to being able to pee without it being so painful. With your GI system now starting to calm down so you're not having so much constipation. So these are all the things that we work on every single day at our clinic here at Rebalance. And what we saw, okay, I've been creating these videos for many years now. We have so many women reach out to us and come to our clinic, and many of them live, all over the United States, but they come here to see us. And what we did is we decided, hey, there's enough people out there that want our help that cannot see us, but they want to know, what can I do? How can I empower myself to get this under control and start to just kind of navigate this a little bit on my own, but then also get possibly additional help from us. And so what we did is we actually created a program on how to start improving a lot of this, okay, on your own at home, to start getting a lot of your symptoms under control and to start getting this navigated in the right way. And so this starts to empower you on how you can get control over a lot of this pain. And down below in the information box, we have actually in the link that you see, prior to even us talking about the program, we have a free 30-minute PowerPoint on discussing how all of this affects you and how it can affect symptoms of like endometriosis and various other things that I'm sure you're going to be like, wow, I didn't realize all of this is connected. But honestly, if I tried to talk about it in this particular video, I would take another half hour. So what we did is we created a free PowerPoint video down below. And then after that, we do talk about our program and what can help. And even if you decide, I don't want to do the program, I just want the free information, great. Listen to it, because it is going to give you so much more knowledge. It's going to empower you on how to take control of this condition and how all of these things are interconnected that your healthcare provider might not be telling you. And then this is just going to get you right to the pathway of what you should be doing. So look at that information box down below. We also have several other ways that you can contact us and reach us. We do case management calls all the time for people around the world, as well as in the United States, of just trying to understand their condition and what's going on and what we recommend, and what referrals we can help them navigate through, so that you guys are getting the absolute best care that we can try and provide for you. So subscribe to our videos. We have lots of other information. I create several YouTube videos every month. And if you guys have particular questions, leave them in the comment box, because most likely I will create another video based on your comments. And we also try and stay very active in answering your questions. And so I hope to see you on the other PowerPoint, and hopefully, you never know, we may even be talking to each other soon. So I hope you guys have a wonderful day, and that this video has helped some of you have a better day. Take care.